Thank you. I'm so honored to be here, and I want to thank Professor Wong for inviting me, and I'm very impressed by the vision of the Dr. Stanley Ho Foundation. So I want to talk to you today a little bit about the work that we've been doing at Washington University, looking at how early experience impacts brain development. And in particular, for many, many years, the standard knowledge has been that the development of the brain is driven largely by genes. But we've understood more deeply recently that brain development is also influenced by the psychosocial environment. We now know that adversity, stress, as well as stimulation and nurturance can impact early brain development. And this is a very important finding because it gives us the opportunity to actually influence the development of the brain by the environments that we put our children in. The other important opportunity is that we know that there are sensitive periods in brain development during early childhood when the brain is particularly responsive to environmental influences. And this provides a window of opportunity for treatment. So the other principle related to the effect of environment on brain development is the idea of biological embedding. And what that really is the process by which our bodies respond to changes in the environment. And when we are faced with chronic environmental stimuli like adversity or stress or very nurturing environments, our bodies adapt to it in a durable way. And this is very much influenced by sensitive periods. So if young children are exposed to adverse environments or stressful environments over a long period of time, their bodies adapt to that in ways that are highly detrimental to their health, whereas if they're exposed to nurturing and stimulating environments, their bodies adapt to that in a way that is very positive for their health. We also know now more about how the environment actually influences genetic expression through a process called epigenetics. And that is where the environmental stimuli actually influence the expression of our genes and cause changes in our brain development. And all of these things are very, very important factors for how we might prevent and treat mental disorders early in life. Now, we've known for many, many years that the environment impacts brain through animal studies. And when animals are studied in different types of rearing environments, like an environment where there's very little stimulation compared to an environment where there's a medium amount of stimulation compared to a very stimulating environment, we know that animals that are reared in a very stimulating environment have much larger, better brain development. And this principle can also be applied, of course, to developing children. And related to this, we know that when animals are nurtured early in childhood by their mothers, the process of being nurtured, in this particular case, being licked by the rat mother, actually causes changes in the DNA, and it makes the DNA then express more genes and receptors that go to the brains of those baby rats, and then the baby rats have larger hippocampuses and better emotion regulation. So it's the idea that if a young child is nurtured by their caregiver, that actually influences positively the development of their brains. We've had an opportunity to study this a little bit in human subjects through a study that we've been conducting in the greater St. Louis area. We recruited about 300 children between the ages of 3 and 6, and we've been following them now for about 15 years. We've been bringing them into our laboratory, studying their development, looking at the relationship and interactions with their parents, and then also conducting brain scans on these children. So we now have 5 waves of brain scans. And we've been able to address certain questions about how the early environment, how the parent-child relationship actually changes the development of the brain. And through this study, we were able to discover that, similar to what I showed you with laboratory rats, children who experienced high levels of nurturing when they were young, and this was nurturance that was observed in a laboratory setting and rated by blind raters, that those children went on to have larger hippocampuses when they were scanned at school age. So suggesting that something very similar to what we know to be true in animals is also true in humans. That when children are nurtured by their caregivers early in life, it produces more optimal brain development. We've known for many, many years that exposure to adversity, things like poverty and deprivation, are by far the most powerful predictors of poor developmental outcomes. This is an issue that worldwide we've really paid little attention to, and now we really do know that there are clear early intervention solutions if we as a society decide to invest in them. We've also shown, and we found this somewhat accidentally in our study, that humans exposed to poverty or low income to needs in early childhood, this actually negatively impacts the development of children's brains. So while we've known for many years that children reared in poverty have lower IQs, poorer educational outcomes, now we can see that children reared in poverty also have poorer brain outcomes, really suggesting how tremendously important the early environment is in the developing human brain. The other thing that we discovered is that children living in poverty, the effect of adversity and poverty is mediated through parental support. So children who are living in an impoverished environment, who have a supportive caregiver, have better brain outcomes, suggesting that focusing on caregiving is a very, very important preventive intervention for children facing adversity. We also know that experiencing poverty and adversity negatively impacts health outcomes in general, so that people who have experienced stressful life events or adverse experiences in early childhood are also at higher risk for developing major medical problems like cancer and heart disease. And again, what we've learned about this is that the experience of adversity in early childhood during sensitive periods changes the way our bodies physiologically react, and that puts us at risk for poor health outcomes. And one of the mechanisms that we think drives this is that adversity experienced in early childhood actually changes brain development, and it changes regions of the brain that are important for regulating our behavior and regulating our emotions. When those regions are not developing well, we then have impairments in our emotional behaviors and health decisions, and then that puts us at risk for poor health outcomes and poor mental health outcomes. And we found that this was true, that children in our study sample who experienced adversity, the more adversity they experienced, the smaller their inferior frontal gyrus was, a key region of the brain that is involved in regulating behavior. And we basically have found that adverse experiences decrease the volume of the inferior frontal gyrus. That was related to poorer emotional awareness, and then that put people at risk for later depression severity. So it's mapping really the mechanism by which adversity puts people at risk for depression and similarly for poor health outcomes. It's really occurring through the exact same mechanistic process. Adversity negatively impacts brain development, which then negatively impacts behavior, and then it makes us behave in ways that make us make poor choices about diet, make poor choices about physical exercise, relationships, that then put us at risk for poor health outcomes. We also wanted to ask the question in this study sample. I previously showed you that children who experienced high caregiving support when they were young had better hippocampal outcomes at school age. We also wanted to ask the question of whether it influenced the whole trajectory of how the hippocampus grew through school age and early adolescence, something that we could address because we had 3 waves of brain scans in our study sample. And what we know about the development of the hippocampus is that it increases in volume rapidly in early childhood and then kind of plateaus. And basically what we found is that children who experienced high caregiving support during the preschool period, not only did they have a larger hippocampus at school age, but the entire trajectory of hippocampal development was changed. So they had actually a steeper trajectory of hippocampal growth across childhood and early adolescence. And we know that this is related specifically to early maternal support. Again, just underscoring how tremendously important this is for nurturing the development of healthy brains. And this just shows you the children who experienced high levels of maternal support had hippocampal growth trajectories depicted by this green line. Those who had average levels are at the red line, and those with low levels are at the blue line. So really essentially saying that maternal support is sort of the food for brain growth, essentially. We know that hippocampal slopes are important. Of course, we all want to have bigger brains and better brain development, but we know it's important because having a steeper growth curve of your hippocampus is associated with better emotional functioning. Those kids who had those green trajectories have better ability to regulate sadness and have less of a tendency to have maladaptive rumination. So we know that having a hippocampus that's growing faster is better for our emotional adaptation. The other question we wanted to ask is whether there was a sensitive period. Is there a time in development when it's particularly important to be exposed to a supportive caregiver? And basically what we found, we were able to look at this because we measured caregiver support during the preschool period, we measured it again observationally during the school age period, and then we looked at how the hippocampus was growing across these 3 waves of scans. What we found is that maternal support during the preschool period was particularly important for the growth of the hippocampus. So while it's always good to have a supportive caregiver, the preschool period appears to be a sensitive period when it has a particularly powerful impact on the growth of the hippocampus. Again, this suggests to us something that's very important about emphasizing caregiving support and teaching caregivers how to support children, particularly during the preschool period of development. The other thing that we were studying in this investigation was the issue of clinical depression. Really, the whole study was launched to ask the question of whether children under the age of 6 could experience clinical depression. And this was really a new question because prior to this time, clinicians assumed that children as young as age 3 could not experience clinical depression, that they were too developmentally immature to experience depression. What this study really showed was that young children between 3 and 6 do experience clinical depression. They have all of the same symptoms and signs as older children and adults. They have the same changes in brain. And the reason why we think this is so important is because if we pick up this disorder early in life, when the brain is more plastic, changeable, and sensitive, and when there are sensitive periods, we might be able to treat the disorder more effectively. So one of the questions we wanted to ask is whether having depression during early childhood impacted brain development later in life. Because while we showed that depression could exist in early childhood, many people might have the inclination to say, well, kids will just grow out of it, it's not that important, they'll get over it. And what we know about, we looked at the issue of how depression impacted gray matter development. And the reason why we wanted to look at gray matter development is because we knew that in adults, in geriatric depression in particular, there were changes in the brain's gray matter. So we wanted to see if early childhood depression also changed gray matter. Gray matter, in contrast to the hippocampus, has a different type of growth trajectory. It increases in volume. These are all regions of the brain in which there's gray matter. And it peaks at about pre-puberty, and then it starts to thin through a process known as pruning. And what we found is that children who experience high levels of depression in early childhood had a very different trajectory of gray matter pruning than children who experience low levels of depression in early childhood. And this was evident even after most of these children had recovered from the depression, so they were no longer in an episode of depression. So what this told us was that just the experience of being depressed when you were under the age of 6 had an enduring impact on the way your brain was developing, even when you got over the depression. So again, it really underscoring how important the lived experience is of the young child and the developing brain. So the way that we interpret these findings is that early childhood depression experience was associated in the change of the trajectory of both cortical gray matter volume and cortical gray matter thickness. Now, many people might have argued that young children who are depressed might have a genetic disposition to have a different sort of brain development. However, there was no effect of family history of depression on the trajectory of brain development, suggesting that it really is related to the experience of being depressed. So one of the things that all of these findings together really tell us is that we know that the psychosocial environment, experiencing poverty, experiencing adversity, we know this has an impact on the child's developing brain. We also know that experiences of depression are having an impact on the child's developing brain. And we know that there are sensitive periods when the child's developing brain is particularly influenced by the psychosocial environment. So what's important here is how early in life can these effects be detected, and therefore how can we optimize brain development based on this knowledge. So we know that parenting is really a key pathway by which adverse experiences negatively impact children. We know that parents who are living in poverty, who are facing adversity, have poorer parenting skills because they're facing so much psychosocial strain and distress themselves. They're less available emotionally to their children, and they're obviously just under so much more stress that they're less able to be an optimal parent. And we also know similarly that parenting has a similar effect on the development of the immune system. So another thing that links the experience of adversity and stress to later illness is the fact that adversity and stress also negatively impacts the developing immune system. So when children are exposed to adversity, their immune system gets upregulated into what's called a pro-inflammatory state. So it's as if the immune system is on alert and is defensive. And this is not a healthy state to be in. Now, those children who experience high maternal warmth, have a decreased upregulation of their immune system. So similar to this process in brain, we see the same positive effect of parenting on the immune system. Again, really talking about how important the psychosocial environment is, and particularly for young children, exposure to positive parenting is for their brain development and their immune development, and then just overall health outcomes. And investigators have speculated on why this is true, that children who experience adversity, who experience harsh parenting, this actually has an impact on their immune system, which also impacts brain development. This then changes their behavioral tendencies and puts them at greater risk for disease and mental disorders. One other newer discovery that's very, very important in our understanding of how the psychosocial environment impacts brain development is the gut microbiome. The gut microbiome was only recently discovered in the past less than 10 years. And what the gut microbiome is an adaptable microbial constellation in our guts that are critical to how we transform food into energy. We've recently learned that the composition of the gut microbiome plays a key role in neurodevelopment, and the gut and the brain are connected through a gut-brain axis, through the vagus nerve, and through a lot of neurotransmitters in our brains are produced in our gut. So it plays a key role in neurodevelopment. Similar to sensitive periods of brain development, the gut microbiome is formed during the first 2 to 3 years of life. It's also sensitive to environmental exposures. So the gut microbiome is very, very much sensitive to experiencing stress and adversity, to what's in the environment. Of course, antibiotics are going to have a big impact on the gut microbiome, and whether the baby is breastfed or bottle-fed. We know from a number of different studies in animals and some in humans that the gut microbiome has an impact on brain development. It has an impact on mood and emotions, and some people have even speculated on there being a role for probiotics in the treatment of some mental disorders. So the implications of all these findings taken together, I think, are very important if we think about the need for prevention of mental illness. So we know that it's very important to identify mental illness as early as possible in life. When the brain is rapidly developing, it's more changeable and plastic, and there are sensitive periods. To do that harnesses experience-dependent plasticity. So it helps us utilize, we can optimize the psychosocial environment to enhance child brain development and protect them from adversity. And the key ways to do this, of course, are to enhance stimulation and to enhance caregiver nurturance during these sensitive periods of affective and cognitive development. So we wanted to develop an intervention to do this, specifically targeting early childhood depression. And as I told you, we now know that depression can arise as early as age 3. We know that preschoolers who are depressed have the same alterations in brain structure and function as adolescents and adults who are depressed. Some of the key neural markers of depression are that people who are depressed tend to be less responsive to rewards than people who are healthy. They also tend to have poorer emotional regulation or top-down control of their emotions. We know depression is a genetic disorder, but it's also influenced by the psychosocial environment. We know that psychosocial factors influence brain development, as I've just told you. So we wanted to develop an early psychosocial or psychotherapeutic intervention as a early intervention for depression and even as a preventative intervention to enhance emotion development. So we developed a new form of therapy called parent-child interaction therapy emotion development. This was built on a well-proven, empirically established treatment called parent-child interaction therapy, which is given worldwide. It's a treatment that teaches parents how to parent their children in a nurturing yet firm and effective manner. It's shown to be powerfully effective. It occurs over 18 weeks. It can be delivered by master's level clinicians, and it's known to have enduring effects over time, even with no booster sessions. So we took that form of therapy, which has a number of features to it that are very interesting. In contrast to a standard therapy, where the patient comes in to meet with the therapist and talks about what happened last week. In this therapy, the parent and child come in, they are seen together in play, and the parent wears a bug in their ear. They're coached by a therapist who's watching the interaction through a one-way mirror. And essentially, the parent is coached on how to parent the child during stressful interactions so that they actually get directions from a trained therapist while they're interacting with the child during an emotionally active situation. And I think this is one of the reasons why this is so effective. Parents come once weekly. They have homework where they practice this at home. The therapist teaches the parent techniques, and then they coach the parent through the techniques. So it fundamentally changes the way the parent interacts with the child, and I think the reason why it's so effective is because then the parent uses these methods as the child grows older. Let me just go through this. Sorry. So what we did is we tested this therapy in a randomized controlled trial. We basically took depressed children between the ages of 3 and 6 and their parents. We put them, some got immediate treatment, and some were in a waitlist condition. We also did an ERP and an fMRI at the beginning of treatment. We did an ERP at the end of what I'd call the standard PCIT treatment, and then we did an ERP and fMRI at the end of the parent-child interaction treatment. We wanted to look at whether this parent-child interaction treatment changed children's depressive symptoms, but also whether it changed their brain's response to reward. And basically what we found is that the treatment was powerfully effective at decreasing depressive symptoms, using 2 measures, at decreasing impairment. It also produced improvement in parental depression, even though we were not directly targeting the parent's depression. And these effect sizes are very, very large. These are effect sizes that are as large as the treatment, as a use of a stimulant for ADHD. So that's the other thing that was very exciting about this. And this just shows you a graphic of the differences between the wait list and the control condition. So using the ERP or the EEG during a task, and in particular, we did this during a sort of a gambling task where children would win or lose points. We knew already that depressed children had a decreased response to winning. They have a decreased brain response to winning, just like depressed adults do. But what we showed was that at the end of treatment, the children who got the active treatment had a marked change in their response to winning. And the children who were in the control condition, their brain response to reward did not change. And basically what we found is that the children who got the treatment started to have a brain response to reward that looked just like a healthy child's brain response to reward. So this was another very exciting part of the treatment, that this 18-week treatment with a master's level clinician produced these robust brain responses to reward, which was a key neural marker of depression. And this finding is coming out in biological psychiatry in the next 3 months. So the thing that I think all of this data really suggests is this idea that treating mental disorders or enhancing brain development early in life is the critical time to seize on this opportunity. This is a slide that was produced by Nobel Prize-winning economist James Heckman, where he does an economic analysis and basically shows that when you invest in intervention during the preschool period, you get a much bigger rate of return on your investment than when you invest in it later in life, and you see this downward curve. So again, really speaking to the idea of neuroplasticity. And again, just thinking about it as if you're investing in the stock market. The more you invest in these things early, they're very good investments for our society fundamentally. Let me just skip over that one. I'm going to skip over that one. So what we're now doing is we've just embarked on a new study building on all of these principles that's funded by the National Institute of Mental Health. And in this study, we're recruiting women in pregnancy. We're recording how much stress these women are experiencing during pregnancy and whether they're depressed during each trimester of pregnancy. We're then scanning the infants at birth, looking at their brain structure and resting state brain function. And then following the development of the infant's gut microbiome and many of their inflammatory factors, also measuring psychosocial stress and adversity during the first 3 years of life, and looking at how these mechanisms come together to either be an advantage for brain development or a risk trajectory for brain development. So to conclude, these data, I hope, showed you that the early environment, particularly the caregiving environment, powerfully impacts neurodevelopment in children. This process is more powerful and early in life, both to our advantage and to our decrement, which is why it's so important to pay attention to these nurturing environments that young children are exposed to. Inflammatory processes and the gut microbiome, as well as epigenetic processes, may all be key mechanisms by which the environment influences brain development. And these well-established facts in human development are very much underutilized in clinical models of health promotion and prevention. And they really raise interesting questions that I think the Stanley Ho Foundation is seizing upon about how we can utilize these principles to the benefit of children to enhance neurodevelopment and enhance health. Thank you.
我哋即刻就有發問嘅時間㗎啦。嗱，如果大家未準備好咧，我哋喺4個演講之後咧，都會有一個提問嘅時間。而家大家在座各位有冇即時嘅問題咧？係。咁啊，禤先生係第一位發問㗎，我哋請阿禤先生。
According to what you just told us, I think the world is not fair. In the sense that the one with a lot of fluency, wealth, and that sort of good things will do so much good to the children, whereas those people are poor and then they don't have it. But I don't see that you talk a lot about the fathers. It appears the father has no role to play in the whole game. But in fact, you know, the fact that they come to the world owes very much to the fathers too.
You're right. Everyone always asks me that question, and I'm not learning my lesson. Really, it's caregivers. So absolutely, they can be fathers, they could be grandfathers, they could be foster parents. I don't think it has to be mothers at all. It's anyone who is a caregiver for a child. But you're right, the world is not fair, but I think we can make it so much fairer if we pay attention to these things.
It's my time? Okay. Professor Joan, thank you for your presentation. It was very interesting.
Thank you.
Okay, I'm a pediatrician and geneticist. I want to ask you 2 questions, if you don't mind.
Sure.
It's the one that, okay, according to your presentation, the mother, the children under poverty and under depression, of course, will cause problems in the neurodevelopment, particularly in the brain.
Mm-hmm.
But it's not only like in this situation, because you know that the growth will also be affected, because you know that when the child is in the outside, living outside without help, there's abandoned child and so on. This child or these children also will have a growth hormone deficiency secondary to IGF deficiency. So it's important for them. The development is in the early childhood be with a good support from the parents, the father and the mother also, and because you know also that even in the asthma attack, if you have some problems, emotional problems, they can have an asthma attack during a discussion, for example,
yes.
During the parents. For the other hand, this is the second one. My thinking is, if the overprotection is not good also, because if you see in the cases that the child is overprotected by the mother, in this case, they can the so-called, for example, the mutism, selective mutism, and so it's important to have a balance in the education among on. I think this is my personal conclusion. Is because if you have too much protected child, you will have problems also. So I think it's as in everything, a balance between the balance is better. I don't know what you think about this.
Yes, no, I think that's a very good point, and I'm glad you raised it, because the idea of a supportive caregiver isn't equivalent to being a protective caregiver. Part of being a supportive caregiver is giving the child what they need in a contingent fashion, and then also fostering autonomy when the child needs autonomy as well. So, I mean, overprotection wouldn't necessarily fall into the category of optimal or supportive caregiving. But nurturance in early childhood is certainly a key ingredient, but definitely fostering autonomy is also a part of nurturance.
Okay.
Thank you, Professor Luby. I wonder, for the parent-child interaction therapy, do you have any recommended trainer, especially in Asia?
Recommended training?
Yeah.
I do. So parent-child interaction therapy is widely accessible worldwide. If you were to Google www.pcit.org, you'll find it. And there are trainings that you can go to. I'm sure there are trainings in Hong Kong and other close places nearby. The ED component that we just developed, you can get access to it through our website, www.eedp.edu, and you can download the ED component. So it should be easily accessible, and I hope you guys take it up and use it.
Thank you. That was a very exciting talk. So I also have a question about the maternal or the support of caregiver or maternal support. Maybe I want to know more about how in the study you quantify or measure the quality of the caretaker support. I wonder whether you are using models such as Bowlby's like attachment theory, or there is something more or different.
Yeah, that's a great question. So in the study, of course, measuring caregiver support is not a trivial matter. And because we didn't want to ask caregivers how they rated their own supportiveness, because caregivers often don't perceive themselves very accurately, we rated the support during a parent-child interaction that was mildly stressful. It was actually something called it's a gift paradigm where an attractively wrapped gift is placed on the table and it's for the child, and the parent has to fill out forms before the child can open it. And so different parents handle that very differently, because the child is, of course, very impatient to open the gift, and some parents are punitive, some parents are try to help the child be patient and wait, and then it's coded by people who know nothing about, who are by trained coders who know nothing about the characteristics of the parent and child. So we think that it's a very robust variable, and interestingly, this ended up predicting brain outcomes better than many other variables that we had measured.
Yeah, thank you for your talk. And I have one quick question. Because I'm not a medical staff, I am wondering, like, instead of just having brain images, how can we identify or assess the children with depression?
So that I'm glad you asked that question, because brain images will not help you assess a child with depression. It's really a clinical diagnosis. We have a checklist called the Preschool Feelings Checklist that you can use as a screener. It's actually been translated into Chinese. Again, you can get that from our website. But it's really based on a clinical diagnosis, seeing a child and interviewing a parent about the child's behavior. The things you would find would be decreased enjoyment of activities and play, withdrawal from social activities, fatigue, excessive guilt, sadness, decreased joyfulness, lasting for several days, most of the day.
我哋最後一條問題啦嚇，好嘛？因為我哋嘅時間係好緊湊嘅。
Okay, very nice talk. Just after the treatment of the depressed children, they show the improvement in brain function and behavior. How long it lasts? I mean,
that's a good question.
Yeah.
We are actually going to be following up this sample. We just got a grant to do that. So I hope to be able to answer that question, but at this point I can't. That's a critical question.
Yeah, it's also for the children development is show their emotion and other cognitive function related to the brain volume. For example, the gray matter. And did you find any change of the brain function? For example, the brain network or brain activation area correlated with the kind of development beside the emotion and other, for example, language and also executive function, memory, and other cognitive functions.
Yes.
Thank you.
Yes, we found a number of different alterations in brain function, connectivity, brain activation, as well as memory, and all these papers have been published and are in press. Yes.
I want to ask, I want to ask that what is the definition of adversity? Because I major in speech language therapy, and I know that we may give some treatment to the child to find their SAC-PD, so they may face some challenge. But you said we don't need to give them too much adversity. So how can we balance it? the SEC-PD and adversity?
Yes. So that's a great question, too. I mean, so there's what we're calling adversity here really has to do with lack of parental support, exposure to poverty, having a parent who has a mental disorder, a parent who's incarcerated. Those are usually the components. So we're talking about really a child who doesn't have their basic emotional and psychosocial needs met. Children, as they're developing, of course, will face other types of adversities that are a part of normal development or challenges, which, are not thought to be detrimental. But these are things that are just the foundational elements of child development are not present. There's not a sense of safety, having a protected environment, having needs met. That's really what we're talking about.